Well, it is 11:30, so we can just go ahead and start. We have a quarterly self-advocate and family information sharing gathering. We want to make sure we take the opportunity to get information out to families, out to people we serve and who are waiting for services, as well as hear from you. So just thank you for coming, and we'll cover some topics, and then at the end we'll have time for like questions and answers. We're really trying to make these meetings as accessible as possible for people who use other languages. So one of the methods that we use are, if you speak another language, there is the closed captioning, that CC in a box at the bottom of the screen. And when you click that, a menu will come up, and then click on Translate into English. A box will open at the top of your screen where you can choose the language you would like the captioning to be translated into. We also have someone here to help translate questions for Spanish speakers. Nadia?
Hi, Angie.
Hi.
Buenas tardes, bienvenidos a nuestra reunión familiar y autodefensa. Esta reunión está siendo grabada, así que le pedimos que por favor ponga su micrófono en mudo. La grabación la puede encontrar el próximo viernes en nuestra página del internet. Para verla puede ir a dspd.utah.gov, presione en Individuals y Families, presione Family Self-advocate y donde puede encontrar la grabación de la última reunión, así como reuniones pasadas. Estamos haciendo todo lo posible para tener la presentación en otros idiomas, pero por ahora solo tenemos disponibles los subtítulos. Si desea usarlos en español, siga lo siguiente. Presionen el círculo que tiene 3 puntitos. Presionen la cajita de abajo que tiene las 2 C. Presione, va a salir una caja en medio de la pantalla. Presione Translated Captions y verifique que se ponga en azul. Presione de nuevo la cajita que está debajo y escoge el idioma, Spanish. Presione la X en la esquina de arriba a la derecha y los subtítulos estarán en español. Si tiene alguna pregunta, en la mano derecha, en la parte de abajo, hay un cuadrado con líneas como si fuera que alguien está hablando. Presiónelo y saldrá una segunda pantalla que dice In-Call Messages, en la cual usted puede escribir su pregunta. Luego presione la flecha para que la podamos ver. Si tiene, puede hacer también preguntas en voz alta. Presione el círculo que tiene en la manito y le haremos saber cuándo puede hablar. No se olvide de presionar el micrófono para que la podamos escuchar. Si desea, puede mandar sus preguntas por correo electrónico antes de la reunión a dspdinfo@utah.gov en español. Estaré presente y disponible durante la presentación en caso que tengan preguntas. Gracias. Back to you, Angie.
Thank you, Nadia. So before we start today, I wanted to remind you that this meeting is being recorded and will be available Friday on the DSPD website under the Individuals and Families tab, and then the Be Informed and Be Involved heading. Please mute yourselves and type any questions you have in the chat box or raise your hand to try and help just make it, to keep that feedback down so it's easy for everyone to participate. Nadia, I think you already translated that part, right?
Yes, that is translated, yes.
Okay, thank you. So we'll just go over our agenda, just give you the highlights. We'll start with announcements, including having our new superintendent at USDC introduce himself, go over other staff changes. We had shared an email earlier that included some survey results. So we'll be going over that with you as well, and give you legislative updates of where we're at in the session, and what steps are being taken. We'll go over Medicaid unwinding. We talked about it last time, and there just have been some updates in it, and we want to make sure we're keeping you current. And then we'll have a presentation on community resources from Trish Jones-Parkin on customized employment. We'll go ahead and start with having Tim Matthews, our new superintendent at USDC, we're really excited to have him. He started in November, and he comes to us from California and was really highly recommended by staff, by peers, by state representatives. He has really many strengths that he's bringing that complement the already great work being done at USDC. So we're so excited to have him, and I'll give him a chance to introduce himself. Tim.
Good morning, everyone. I'm Tim Matthews. Thank you for the great introduction, Angie. I hope I live up to the expectations. I've been here for about 3 months now, since November, and I've really gotten to know the team, the staff, the individuals that we're serving, and I just know that this is a great work that we're involved in. For about the past 25 years, I've spent working in the community and community-based organizations advocating for individuals. This feels a lot like home to me, and now I get to experience the other side of it, kind of on the state side, the provider side from the state. And so I'm really excited to be here. I hope to add whatever I can to this team and to the services that we're providing for our individuals. And I really appreciate this opportunity.
Thank you, Tim. Next is just one of the things DSPD is going to be doing a series of meetings to discuss the support coordinator's role in this person-centered planning process. And we'll use this information for a few projects. One of those projects will be to create a survey to assess the planning process from the perspective of the person. And so we're requesting participation from individuals receiving services and their families to share their experiencing working with your support coordinator, preparing for your person-centered support plan meeting, and how services and supports are provided throughout the year. We're currently planning additional dates, but the first of these feedback sessions will be held virtually and at the USU Salt Lake Center on February 28th of 2023 this year. And there will be a session from 12 to 1 and another from 6 to 7. So 12 noon to 1 p.m. and 6 p.m. to 7 p.m. Links to the meetings will be added in the chat and to the notes of this meeting. Also, living the life you choose or preparing for my person-centered planning meeting. I'm going to give a minute to Lisa to talk about that. If Lisa, are you on? There's a big list and I can't see.
I am here, Angie.
Perfect.
Thank you. And thank you for this opportunity to talk about this wonderful resource, Living the Life You Choose, Preparing for My Person-Centered Planning Meeting. It's a new resource available to individuals to help them prepare for their Person-Centered Support Plan, or PCSP meeting. Written in workbook format and with settings rule requirements in mind, it explains to each person their choices and rights, what person-centered means, the person-centered planning process, and it includes links for several person-centered planning tools. The workbook is a fillable PDF document with embedded links to help navigate from content to the workbook pages. When completed, the person can print or share the workbook pages with their support team at the PCSP meeting. Living the Life You Choose aligns with the Person-Centered Planning Foundational Handbook for Support Coordinators, and both of these resources and many others can be found on DSPD's Person-Centered Planning webpage. We'll put that link in the chat, and the workbook can be accessed directly from this link that will also be shared in the chat. And we hope that you will use it to prepare for your person-centered planning meetings. Thank you, Angie.
Thanks, Lisa. So I'll just go over some staff changes that we've had. One is Laura Ellsworth is going to be our caseworker specialist who's working with people who are civilly committed to us. So sometimes we have people who are civilly committed and they need someone with kind of some expertise around the support needs there. And so we're really excited to have Laura working with us. Kelly Unger is on our assessments and support coordination team as a caseworker specialist. So this is really a critical role as we get services in place for people, and we're excited to have her and welcome her. Cheryl Adamson and Austin Aiken, they are financial managers on our finance team, which is so critical for us in making sure we're able to pay our providers, pay when people use self-administered services, or even when we're doing our one-time services through the waiting list. So we really are so grateful to have really just talented people joining us to help keep every part of our division functioning and working well, so that like everyone just experiences a has a smooth experience. We have Jacinta Ofahangawe. I really just do my best on her name. She is a caseworker on our community transitions waiver. That's our team who is helping people transition from intermediate care facilities to the community when they're interested. And so she's supporting people who are like having that first experience in the community. Emily Skardorova is our employment first program specialist. So she's focused on how to support people to be integrated, how to support people in finding jobs that they're interested in, getting like in working on how to have that work in our division since we contract for that service. But we're excited to have her, and she brings a lot of experience with her as well. And Rick Burrell is our master electronic business manager. That is our U-Steps, My Steps, UPI. So those are our case management systems that are online. So we're excited to have him and the experience he brings. And then Anna Dees is on our intake and waitlist team. And as you know, that's really a critical role. We have a waiting list of over 4,500 people. So having people who can help keep needs assessments updated and like work with families when they're looking for resources and understanding how to apply for services. We're really grateful to have these people join us and all of the experience and background that they're bringing with them. With that, we're going to move on to talk about the surveys that were the results that were shared. So I'm going to give some time to Tyler Black.
Hi, everybody. My name's Tyler Black. I'm an administrator with the Division of Services for People with Disabilities. And I just wanted to first thank you all if you participated in some of our survey activities in the past. The information is really valuable to us as we report to the legislature on different programs that we're running. But the two that I wanted to talk to you about today are the caregiver compensation survey and then a waiting list survey. So the caregiver compensation survey, this is a program that we introduced during the public health emergency. And we conducted this survey recently because there was a lot of interest from legislators to understand the outcomes of this program. And what we found from doing this survey, we compared people who were using the program with those who were not using the program. And we found some significant differences in some quality of life outcomes related to caretakers being able to spend more time with their other family members, and then just greater financial security that the family experienced. This survey that we're working on that is going to be a longer term project is looking at the impact of our services. And we gathered some baseline data. You may have received an email and filled out a survey. We send it out to everybody who is on our waiting list. And it asks a lot of those quality of life indicators about both for the caregiver and the individual with a disability. And so you can see some of the baseline data that we reported as a result of that survey. And what we're going to do is look over time and see how those quality of life indicators change, specifically when somebody begins receiving services through DSPD, so that we can compare like a pre-test, post-test, and see how those quality of life indicators change over time, and hopefully be able to demonstrate the value of our services and the impact that it has on people's lives. So just thank you again for taking the time when you see those emails with those surveys. That's really useful to us. And we also just wanted to make sure that when we do survey you and gather information, that we have a mechanism in place to report back to you, and so that you can see the results of those surveys that you're completing. If you go to our website, dspd.utah.gov/research, you can see, if you scroll down to the bottom of that page, you can see more detailed analysis for these surveys that we talked about today. And then we'll continue to post more analyses on that website in the future. There's also on that page, if you go to dspd.utah.gov, there's a menu at the top that says data and research. You can also look at some interactive dashboards that we have. And we hope to, in the next 6 months or so, I'm working on a project to gather more. We have a lot of partner agencies that in higher education that are also doing a lot of studies on people with disabilities living in Utah. So we want the DSPD website to be kind of a clearinghouse of information, where we can gather all those studies and have one site where you can see all the different work that our research partners are doing. So thanks for giving me a few minutes, and thanks again for helping us gather that information.
And Tyler, I just saw someone had put in the chat that they wanted to take the survey, but these surveys are closed, right? They've already been administered. We've done the analysis. I don't know if you just want to speak to that.
Yeah, that's correct. But the waiting list survey will be there will be future surveys asking the same questions. So just watch your email, and if you're getting notifications for these meetings, then you're also going to be on the list to get emails about surveys that we're doing in the future.
Thanks, Tyler. And if you're not getting emails, please, you can email dspdinfo@utah.gov, and we can add you to our mailings if you're interested. So I'll just give you guys some updates on the legislative session and where we're at. So our Utah legislative session is in full swing. And we've already seen many parents and families advocating at the Utah legislature. So thank you for the time and effort you put into making sure that your voices and the voices of families and the perspectives of families and needs are being heard by legislators. DSPD staff has had the opportunity to share information in legislative committees for several issues, and to present our funding requests that were included in Governor Cox's proposed budget. So last week we were able to present to the Social Services Appropriations Subcommittee about our needs. So we had 3 ongoing requests. One is called Mandated Additional Needs and Youth Aging Out. So this is when people are already in services and their needs change. So whether they're aging, their parents are aging, just their conditions change and they may need additional staff or additional services. That's what mandated additional needs are. When we provide services through a waiver, we're required to meet the changing needs of people. So we ask for funding to help make sure we can do that. And then youth aging out is when youth are being served by Juvenile Justice and Youth Services or the Division of Child and Family Services. They pay the general funds to get the match from Medicaid. But when someone ages out of their services, as they become an adult, DSPD becomes responsible for paying the general fund part to be able to get that Medicaid match. And so that's what that first request is about, mandated additional needs. And we also requested funding for the waiting list. It would to be able to bring in over 200 people from the waiting list this coming year. So we're just asking to be able to serve more people. And then the nursing rate increase is for the community transitions waiver. So when we were planning for our settlement and looking at what the needs were and what some of the barriers were that people experienced in being able to move out of an intermediate care facility into a community-based service, one of the needs was having access to nursing. And so that was included in that waiver. One of the things we've noticed as we've been implementing this is that it's hard to maintain that service because the rates are unsustainable. So we're asking for a rate increase for nursing so that we can have that be a sustainable service on that waiver, so that people are able to remain in the community who want to be there, as well as are able to move. We also have uses for one-time money, so one-time requests. One was caregiver compensation. And so just part of caregiver compensation is using ongoing money. So when we were appropriated money for spousal caregiver compensation, it ended up being more than was needed in our system. It wasn't utilized as much as we had anticipated. So we still had money as a result of that. So one of the things that we proposed is that we're able to use that money internally to help cover the costs of caregiver compensation for guardians and parents. We know that that isn't enough because we know how many people are using it and what those costs look like. So we also said we want to also be able to use one-time money for fiscal year 24 to be able to pay for caregiver, like to make up the difference so that we can stay whole, kind of continue the model similarly to what we have right now, as far as like the amount of time that's available. So that one is a little bit of a combination, but it is just reallocating money that's already in our system. We're also, one of our requests was to be able to reallocate money over a 3-year period. So typically we would be using our carry forward, our non-lapse money in fiscal year 23. But what we've asked to do is just say, we have this money and we have this need. So with USDC behavioral unit, what we're wanting to do is be able to contract with a psychologist and a psychiatrist. We're serving people who have complex needs, who typically have co-occurring conditions, and we want to be able to give them the best services possible and be able to tackle some of their needs so that they can stabilize and decompress while they're there and have what they need to help that happen. So with that, we want to be able to use the funding for the fiscal year 24, fiscal year 25, and fiscal year 26. We really want to be able to implement this over 3 years so that we can see what that impact can have for people. We really believe it's essential and it will be very valuable, and we'll have measures on that. We also have are proposing what is called a reserve account. So because there are times where it can be hard to predict all of the needs that are coming or needed, it could also be due to like a leap year, like having an extra day of services. But there can be factors that impact our service system and the funding that could make us exceed that. So to be able to like have a way to make sure that we have the funding necessary, what the reserve account is keeping, using our non-lapse funding, keeping the equivalent of 2% of our budget, so that we have the money if there is something that happens. It's more of like a safety net so that we can make sure we can meet the needs of people in urgent or emergent situations. And then our final one-time request was for supported living and respite. Again, it would be using existing money in DSPD's budget from carry forward money that we have. And rather than using it in fiscal year 23, we'd commit to using it in fiscal year 24. And we know that it can be very difficult to access respite. And we're seeing similar challenges with supported living. So what we had proposed there is that we're able to do some grants and have providers look at like what are some things that can help make this be a viable service, and implement that and have some measures so that we know and we can learn from this and look at how to make sure that we have the right services across our system so that we can meet the varying needs of people with disabilities and families. Our carry forward funds, our committee simply acknowledged that those are within our budget already and that we are funding them internally. So we're going to be planning the implementation of those. Otherwise, everything else is going through executive appropriations. And so they've been prioritized within our social services appropriations subcommittee. That list of priorities has gone to, is being shared with the Executive Appropriations Committee, and we'll just keep you updated as things progress and we know where things land. So that is where we're at in our presentations. And I know we hear regularly from families who are interested in advocating with the legislature. I've had calls from families this week. So we wanted to also just share with you some resources of where to reach out. The Utah Parent Center, they're a parent advocacy organization. They are a great partner to reach out and coordinate with. The Utah Developmental Disabilities Council and the Legislative Coalition for People with Disabilities. They've all been actively engaged during this session in advocating for needs of people with disabilities. And they're a great resource for families and for people with disabilities. I'm going to give some time to Joseph he's with Utah Medicaid in our Division of Internal Healthcare to go over Medicaid unwinding.
All right, thanks, Angie, and good morning, everyone, for at least one more minute. Thanks for having me. Have actually some recent updates that just came out, so hopefully some timely information for everyone. But just to start off with some background, and apologies for those that attend these meetings on a regular basis. You're gonna hear me repeat some stuff from last time, but I think important to share some of what has happened across the last few years. But as part of the public health emergency with the COVID-19 pandemic, there was a requirement that we call continuous eligibility within the state, where one of the conditions for the state receiving some additional federal funding at the start of the public health emergency was to ensure all individuals on Medicaid remained and had continuous coverage during the public health emergency, as kind of one less layer of concerns to worry about during what was a very challenging time. As a result, because we kept everyone on and then obviously admitted any new individuals who applied and were determined eligible for Medicaid coverage, our Medicaid rolls have increased by about 64%, which places us third in the country. And Utah Medicaid now has approximately 509,000 members on the program. With some legislation that was passed by Congress at the end of December, it's called the Consolidated Appropriations Act. This guidance provided the states the ability, or at least the instruction, to remove some of the funding pieces that we're getting from this continuous enrollment policy that exists. So the federal public health emergency still is in place, but as of April 1st of this year, we will start the continuous, or we will be removing the continuous enrollment requirement for Medicaid. So kind of what does this mean, and then how does it affect individuals who are receiving services? We're calling this term, or we're referring to it as unwinding. And beginning on March 1st, so beginning next month, the Department of Workforce Services will start reviewing all Medicaid cases over the next, what we're calling the 12-month unwinding period. So members are all assigned a review month, and their case will stay open until that scheduled review month. We're encouraging, members are encouraged to continue using their benefits as normal until the Department of Workforce Services completes that review. So since DWS will need to review all Medicaid cases within the next year, we're asking members to wait until they receive their review before taking any action. After February 10th, 2023, so just in a couple of days, members and families will be able to see that review date or see their review month in the My Case portal. So for anyone who's familiar or has used My Case to manage, maybe apply or to check on information for your case, you'll be able to see the review month at a glance there. So kind of the call to action, or the pieces for you to be worried about, or I won't say worried, apologies, but how you can stay best informed. Number one is to keep your contact information current. Across the last 3 years since the March 2020 public health emergency, a lot of individuals have moved in that window. Where we kept the cases open, it wasn't necessarily super important as a result for us to kind of continue the review process during that window, as kind of, again, eligibility was just pushed forward until that time. So when it's time to complete that review, it's incredibly critical that we're able to reach you. So again, contact information, be it address, phone number, email, please ensure that the Department of Workforce Services has the most recent information for you. You can see the numbers on the slide, 866-435-7414, or you're welcome to contact one of our health program representatives at Medicaid to report any changes at 866-608-9422. Again, contact information is key to us making sure that you're getting the appropriate information, you're getting informed of when that review comes due. So the other piece to watch for, whether or not you check the My Case portal or not, you will receive information surrounding the review in the mail. So watch for any announcement letters from Workforce Services, or perhaps the review forms themselves as they come out in the mail. So double check your email as well if you may have signed up for electronic notifications, and make sure that you're responding to the timeframes that are given. It's typically about a 30 to 45 day window when they're asking for those in advance. So again, just try to keep up to date there. There's also a Medicaid portal that we have set up surrounding the unwinding, where different announcements can be found. And we're trying to provide as many announcements to the public as we can there to keep everyone informed of where we are in that process. So as much as you're able as well to share with kind of the families that you know of who are receiving services, we're also asking our provider network to keep on top of that, and certainly our support coordinators, ensure that they're aware and working to make sure that families are completing their reviews timely. The Unwinding Toolkit is also available in Spanish as well, in order to help with some of that communication. So think we're ready for the next slide, but we want, again, our aim is to make sure that everyone who's eligible today remains eligible and stays covered. For again, for most of our families who have been participating on the waiver programs, that should not be a concern. But again, it may be the collection of most recent bank statements in order to validate eligibility. So for those who do end up losing coverage for a known eligibility reason, that's not just failure to complete the review, we will send information over to the federal health insurance marketplace in order for the ability to take a look at what other plans may be available should a family no longer be eligible for Medicaid. So losing Medicaid or CHIP coverage is considered a qualifying life event, which will allow enrollment in a marketplace plan outside of an established open enrollment period. Again, not anticipating seeing this for a lot of the families who are receiving services through the waiver programs. But you can visit healthcare.gov or the Marketplace Center. That information is on the slide as well. If you're looking for information on marketplace coverage. So some other helpful information for you. Again, the contact information for workforce services, the health program representatives that are with the Department of Health and Human Services, the Federal Health Insurance Marketplace, Take Care Utah, and 211 who can assist with linking you with coverage. And then again, just keeping up to date on the Medicaid website for any updates there. But again, the one thing that I can stress the most to everyone is, again, and you're welcome to use either of the DWS numbers or DHHS health program rep numbers, is if you've had a change in your contact info, please let us know so that we're making sure that we get review information out to you, and it's not so that we can work on keeping cases open.
Thank you, Joseph. Okay, we're going to now hear from Trish Jones-Parkin, and she is, I think we're going to pause our presentation because she has her own on customized employment. She's a great partner. We love working with her. I used to work directly with her. So anytime we get to have her with us is a perk and a bonus. So welcome, Trish.
Thank you so much. I am thrilled to be here and excited to talk about customized employment. And I understand that several of you are individuals, you have children, whether they're adults or younger, that are on the waiting list. And so I am hoping that you will understand that this is a strategy that can work for anyone. And we're going to talk about how you access customized employment services towards the end. But I just wanted to talk a little bit in detail about why it's a benefit and just, understanding what is available and maybe knowing how to ask for something and why it might make sense for your child. And I say that whether they're an adult or a young person, just makes sense. Understanding that there's something, different out there than some of the standard approaches. I apologize. I started my slideshow a little too early and then I couldn't find the share. So just a moment. Oh, it doesn't like my PowerPoint. Let's see. Let's try this screen. Can you see that okay?
I can't see anything.
It's not letting, let's see. Shoot. Oh, I have just had to do, let's try that. Of course, there's always something, right?
I know every platform has like its own kind of little quirks or things you have to learn.
Let's try that now. Thanks for your patience with me.
Sure. I'm always happy to drive for you too, if
Okay.
you want me to.
Yeah, same. If you need some help, just let us know.
Let's try one more time. Okay, if somebody else would like to try sharing, and then I can just say next. I think I've given it all I have left before I start getting flustered.
Yeah, I'm happy to.
Thank you. Hopefully you're taking a minute to get a snack or refresh your coffee, whatever.
Here it is.
Thank you. So this just has my information. And so I work at Utah State University. And we are the Center for Excellence on Developmental Disabilities, the University Center. And so almost every state has one, and part of the university system. And we're really fortunate in that we partner a lot with our state agencies, including Services for People with Disabilities, and then also Utah State Office of Rehabilitation. So we provide a lot of training and technical assistance to providers and others in our state. And we have several grants and contracts that we're currently operating under to do just that. And so that's part of my role at the university, is to really work with providers and anyone who's focusing on customized employment to really be able to implement that work and do it well. And so that's what I've been doing the last couple of years, and it's something I'm really, really passionate about. And started doing that work at DSPD in 2012, actually. And so we've been doing this work for a long, long time. And it just takes time to build capacity within the provider system and schools and all the kinds of things that we've been doing. And interestingly, Utah is one of the states where other states say, hey, we hear that you're doing this, and they want to learn more about the collaborative way in which we work and how we support each other between these partnerships between the university and state entities. So really proud to work here. And then Amy Langoni is with me as well. And we'll answer any of the questions related to BR that we have, and has certainly been a wonderful partner from the beginning through all of this work. Next slide. I wanted to just start out by saying, I love this quote, that high achievements always take place in the framework of high expectations. And I believe that is really one of the foundational elements of customized employment. And I'll talk about those values in a little bit later. But really is, you know, just when we have those high expectations for everyone that we support, whether that's our own children, our coworkers, and just the system as a whole, we see wonderful things, right? So when I meet students or individuals who have, you know, been in a family where they performed chores, or, you know, they had lots of expectations just like other children in their family, we often see really good things happening for those young people, or, you know, in the schools that they attended, participating along with peers with and without disabilities, and involved in experiences that were not just for people with disabilities. There's lots of research, lots of evidence that points to those elevated expectations. It doesn't mean that if people don't have those experiences that we're not able to figure things out. It just, having that framework is so helpful. Next slide. So a customized approach to employment is different, but really what it is customized employment is a service, and it's available through an employment service provider. agency, and it's a strategy really that helps people find jobs, and we match their interests, their skills, and conditions of employment, but we're also looking at the needs of the employer. So oftentimes with other strategies, we're almost looking at labor market approaches, or, you know, we're not always looking at both sides. And with customized employment, we spend a lot of time up front really understanding who a person is, but then we also spend time in the business community and make sure we're matching those up. So we begin the process with what we call discovery, or discovering personal genius is the people that I was mentored by, Griffin and Hammis. And we really get to know what the job seeker is good at, what they do well, what they might want to learn more about. And we really look at their social network. And that involves, you know, their family. It might involve their community. It might involve, you know, their whole support network. We also maybe look at the agency that's supporting them and who do they know, extended family. And this is not a charity approach. We're not asking for favors. We really just want to know who are you and how are you connected to the community, and where can we get advice and make those connections matter for this person. And so we use that information to figure out where this person might be able to contribute. And again, just getting advice is really what we're looking for. We use this individualized approach to employment planning and job development. And this is about one person at a time, one job at a time. We're not trying to set up social enterprises or create a business where only people with disabilities work. And I'm not saying those things are bad, but this is about one person, one job at a time. Next slide. So the difference is that, you know, the reason that customized employment is within the realm of supported employment is because we're often working with people who have been identified as having the most significant support needs. It's oftentimes customized employment has been implemented for people who have not been successful with other methods. And so when people need a lot of support, that's usually meant that they either are actively getting supported employment or they qualify for supported employment services. So I want to just point out that customized employment is not better than other approaches. It's just there are some differences in the way that we approach, and it really has been helpful to take some time up front when somebody faces multiple barriers and complex barriers to attaining meaningful work. And so that's really the piece that I want to point out. Next slide. Sorry, I'm not used to having somebody drive for me. I apologize, the text is a little small on this one. So some of the beliefs that are really important to understand about customized employment is that we come from this framework of everybody has a personal genius, that everyone has a story to tell, and that people are the experts in their own lives. And we really believe in the power of families, friends, and their community. And if a person is a little bit more isolated and maybe doesn't have a lot of that for whatever reason, part of our role as we're doing discovery is to help build that and identify places where that could happen naturally. There's a lot of subtlety and nuance and, you know, just really kind of going where it makes sense. And it really, you know, it's a great fit for people who are creative and want to try different things and have that open approach to life. So it's a really good fit for employment specialists or anybody in this who wants to do this work and be creative and find new ways of doing things. We also believe that people are lifelong learners, and that skills are not something that, you know, are static, that you can always kind of learn things and get better at them just like everybody else. We just often don't give people opportunities to do that. And certainly not in the limited assessment type environments that we've set up for people in our systems. We also believe that there's an unlimited way to make a living in this world. And if you think about it, I certainly know that I find a different way of somebody making a living or doing something for a job every single day. There are opportunities within every community size. I hear people say there are no jobs in our community, but yet there are people making a living or doing things where there are no signs, right? And so thinking about just different ways in which somebody can make a living. We want to create a sense of urgency instead of always having that thing about, well, someday we'll talk about that. This person, somebody has been in, a sheltered setting or other kinds of things for years and years and years. We want to have a sense of urgency about helping somebody get to that next step. We also believe in the power of reciprocity and having people, part of social capital is the notion of giving and receiving, just like we all have those relationships. I think oftentimes in our systems, right, people have been the receivers of good work and people doing for them, and people not getting that experience to have the other way, right, and being part of something and being part of their community and finding ways in which they have those reciprocal relationships. Next slide. So we really look at the person. We're not looking at who's hiring. We look at what are the skills, what are the strengths, and the needs of the person. This becomes the foundation of creating employment outcomes. So if somebody is really good at making toast, and that's kind of, we start with that. Where is making toast valued, and what can we build on that? That's one task, right? But I often have worked with people and say they literally can do nothing. And then I go and I spend time with them in their home, and they're moving their laundry from washer to dryer. They're bending down and picking up the laundry basket. They're rinsing dishes. They're using a switch. There's lots of things, if you break them down into individual tasks, that people are doing, but nobody's giving them credit or identifying those as singular tasks. With customized employment, we're meeting the needs of not only the person, but the employer. We also think about supported self-employment as an outcome. That is not as common because it does take a lot more support in terms of that consistent support for somebody to operate a small business. But it is certainly an outcome of people going through customized employment, and there's lots of good examples of that. We really use a lot of flexible strategies. So talked about self-employment, resource ownership is another one, where somebody might come in with some tools or a piece of equipment that an undercapitalized business might need, and that piece of equipment generates revenue that then can pay that person's wages. So again, lots of examples that I'm not going to go into today. But again, we're just really giving the opportunity to be creative. And this is where Voc Rehab has been such a wonderful partner in helping us fund and seed some of these kinds of ideas, because we're presenting them with good evidence of why this makes sense during the discovery process. Next slide. So the customized employment values, it's a very person-centered process. Lisa talked about, the person-centered pieces, and it so aligns with all of the things that DSPD has been working on. And I genuinely feel like the discovery process is very person-centered, but very focused on employment, and then also looking at all of those pieces in a person's life that can strengthen what opportunities they might have in employment. Choice is important, self-determination and empowerment. We presume competence. It is much more damaging to presume that someone is incompetent than it is to presume that somebody can do more than they're able to. I believe that 100%, that you can always, kind of back down. And I have been shown that time and time again. Social inclusion is another value. We always do things in the community where things are happening, not in segregated settings or in a person's home where they're the most comfortable. Zero exclusion. You cannot fail discovery. If somebody says that they failed discovery, they did it wrong. there are times that we don't always figure out what employment looks like for people, or it takes a long time, but it's not because they failed discovery. It's that we didn't figure out all the things that that person might have needed, or our system processes didn't quite align, or a person decided not to pursue employment, or health kind of got in the way. But you cannot fail discovery. And again, those community settings and leading to competitive integrated employment. Next slide. I wanted to share a quick story. This is Abby. I did get her permission to talk about her experience, and the employment specialist that worked with her. And so Abby is a person that receives DSPD services. She was exiting school and had had quite a few work experiences that just were pretty standard in terms of what students do, kind of rotating through some of the job sites. And but none of them were just things that she was super excited about. So Mary went through the customized employment course, and so I spent a lot of time mentoring her and getting to know Abby. And one of the things that she was concerned about is she was getting ready to leave post high school. She was also receiving living supports from a provider. She'd been going to a day program in the summer and was planning on going after school, but also wanted to work. And there was all of these things going on, and she was really worried about, how do I make sure, if we, as we move into this job piece, that all of these things coordinate and support together. And she wasn't as familiar with the DSPD services. She's not a DSPD provider. She only works on the VR side of things. And so we really worked together with all of these partners, having several planning meetings along the way with the family. Her grandmother, I think, was a co-guardian with her mom. Lots and lots of people in Abby's life that wanted to see her be successful. Great VR counselor, great team on the school side. And so as we went through this process, we really lined out who was going to do what, and where those transitions were going to be. So Abby left school with a customized position at this specialty market, really focusing on her interests around beauty, organization, and customer service. She's very friendly. She loves to be around people. And so they created this position for her at this market where she works in the seasonal area. She does some other things in their little kind of deli coffee shop, and then other things around sampling. So really it was a customized position for her. She's learning new skills. Anyway, the reason I wanted to share this story is because of all of those complex pieces of where she was getting services, and how in the past I've had situations where the ball was dropped, or somebody said, well, I'm not going to, we're not going to take her to work, or this isn't going to work out, or she needs to go to the day program on these days. And none of that happened. Everybody came together, understanding what made the most sense for Abby. We shared the discovery staging record. Everybody came to the planning meeting. And these photos are things that happened during the discovery process that she was excited about sharing, and the different experiences that we went through. Next slide. Sorry, I don't want to go over my time. So the last thing is, I wanted to just kind of give you some timelines. There's kind of some misnomers out there about discovery takes too long, it takes a year. That's not true. When discovery is done well and to fidelity, which is how I train people and expect people to do the work, it should take no more than 14 to 16 weeks. It can go longer, if people agree, or but for the most part, this is what it should look like. We do spend quite a bit of time getting to know this person, but a lot of this work leads right into job development. And so that piece doesn't take quite as long, because you're doing all of this foundational work. So at the end of discovery, you have a list of 60 businesses where it makes sense to start thinking about employment. You have a visual resume that has been created, and you're doing a customized employment planning meeting with the whole team and getting input from everyone. So it really is a powerful process that engages the whole team, and can really make a difference for someone. I think there's just one more slide. So how to access CE services. So right now, Voc Rehab is the primary funder of employment services, and that includes discovery, which is the first phase. And there are providers who have gone through this training and are certified or have the certificate to provide the services and specialize in it. And so that's, you know, applying for VR, getting connected with a provider to do that. And then another option, if this is something, if you're not, you know, ready to go to VR, you're just still exploring, or you're a student, we have a project that is funded through IOTI, which is an acronym for Interagency Outreach Training Initiative, that my colleague Kelly Hess is doing. And she's been partnering with the local independent living centers and teaching families and self-advocates to go through the discovery process with some group sessions, and you walk away with kind of your own profile and all the kind of tools to kind of go through this process a little bit yourself in a guided way, knowing that not everybody has access to providers, or that maybe needs it and just kind of needs some different ways of thinking about going about employment. So that's also an option. And if you want more information, please reach out. I'm happy to, you know, have a phone call, whatever you need to tailor and really guide you to what makes sense for you. I think that's it. Thank you so much.
Thanks, Trish. We've had some questions come in while you were presenting. And we're at our Q&A part of the presentation of our meeting anyway. And since you just presented, I think it would probably make sense to start with the questions that came in. So one is, how is this different than Voc Rehab?
So it's different in that this is a service or a strategy that's typically funded through Voc Rehab. So it's a service that you might get through VR. Amy, you might be able to explain it better.
No, I think you hit the nail on the head. And I apologize, my camera is off. I have a new computer and it's posing some challenges today, so I'm leaving my camera off. But yes, it's a model or a set of services that VR can fund. So just like when we hire job coaches for other supported employment, it'd be similar to that. It's just using this different model.
Thanks, Amy. And I think you'll probably be up for the next question. It says, with Voc Rehab, we have been waiting over 4 months and can't even get an appointment to do a work assessment to even get employment for my son.
Yes, so Cindy, if you want to reach out to me directly, I can help you troubleshoot. We do not have a wait list, so we'd have to kind of look into what's happening in your situation. So feel free to email me, or I can put my phone number in the chat also. I'm happy to help you troubleshoot.
So Amy, if other people have that, like, is there somewhere they should contact if they're kind of running into that?
Yeah, good question. So I would call your local office, and if you're not, if you've already tried to contact the counselor, if your son or daughter or you have a counselor already assigned, I would try to contact them first. And if you're not hearing back, then ask to talk to a supervisor in the office. And then anytime, you're always welcome to call me as well, and I can try to help you troubleshoot as well. But the best way to start is just to call the counselor if you have a counselor assigned, and then go up the chain of command. All of our offices have a supervisor and a director over the office. So they'll be able to help you if you're not able to work through your VR counselor.
Thank you, Amy. Bryn, this next one might be for you. It says, is the expectation that people receiving DSPD services will work until they are 65 and then retire similarly to the general public?
Yeah. Hi, everyone. I'm Bryn Peterson. I'm with the Employment Planning and Inclusion team at DSPD. I think the answer would be that that's all on an individual basis. same as it would be for all of us. Some people choose to work into their 50s. Some people choose to work until they're 65. Some people choose to work longer. Everyone needs that choice, and they can change their mind. So we provide that informed choice for employment. And these are the services like customized employment and voc rehab that can help to individualize that, so the person can be as successful in their job as possible. And I bet maybe Trisha and Amy want to answer part of that as well, but I don't know.
I would just agree. It's very individualized. I worked with people doing discovery and customized employment that got their first job at 50 and were so excited because they didn't get the opportunity to do that before. And even some people that were older. And again, it was something that they wanted to do. And so I think that's really, really the key. And understanding that, right, experiences have so much to play into that, and giving people those opportunities to have really good individualized experiences that are based on the things that they really do want to try and do.
We want jobs that are connected to our interests also, and we're also not saying not everyone works full-time employment, right? So that depends on each person and what they want to do. Anyway, that could be a whole nother hour of that question. Maybe we'll tackle that in the future.
Thank you all. I have a few more questions, but Marianne has her hand raised. So Marianne, let's hear your question.
I don't know if it's a question so much as a comment.
Okay.
I've worked with folk rehab as a registered nurse, taking care of employees who were injured in the workplace. And I also have an adult son who has Down syndrome and is very functional. And I've had a very negative experience. And I just wonder if things have changed in the last year or so, because I would send employees in for work evaluations, and some of the outcomes that they had bringing back were just seemed kind of ridiculous. And then with my son, after he got through his post-secondary school, we started with voc rehab, and we went at it for 2 years, and we had so many different caseworkers. The turnover was large. The South Jordan office asked me not to come back, and I didn't do anything other than I didn't go to any of the workshops and things that they had going on for a while because I was working. And frankly, I'd already been through a lot of that training. And then I went to West Valley and kind of got going there, but we had 3 or 4 different caseworkers, and then we finally got a job experience. And then I didn't hear anything for 6 months, and I finally just called him back. I said, look, I don't want to be wasting state money because I don't feel like this is doing anything. And it's just very frustrating.
I can speak to that. So thank you, Mary, for sharing your story. And we have, I think you asked if we've had changes. We have had some staff turnover with VR, and then also with our job coaching companies that we are adult providers, or we call them CRPs at VR, but we have seen some turnover, and it seems like we have some new counselors, and it seems like things are starting to stabilize, just like a lot of other industries, as we've seen with COVID and things like that. So we do have some new folks, and we've seen a little bit of stability, knock on wood, with both our staff and our CRPs or adult providers. So hopefully that will be seen through our clients as well. But again, you're always, if you have concerns, it sounds like you did call the office, so thank you for doing that. You're always welcome to, or encouraged to, call leadership through the offices, or again, you can contact me and I'm happy to help if there are concerns that you're seeing.
I wouldn't mind meeting, because I wouldn't mind doing a part-time thing with my son and having some other kids come too, and just doing some kind of something that's at least contributing to society and keeping them busy and letting their parents have a break. Anyway. Just a thought.
Thank you, Marianne, and thank you, Amy. Another question. What if we live way off of the Wasatch Front? The closest stoplight to us in Utah is in Kanab, and that's an hour away. So, Trish or Amy?
I know, just speaking for VR and our services, we have been able to meet virtually with folks. We do have offices spread out throughout the state, but we also can meet virtually too. So that's kind of helped with some of the rural areas and some of the challenges with transportation.
Right. I was just going to say, I know that in terms of like customized employment providers, I do have people coming through the course that are down in that area, and I do the training virtually, and then I do mentoring in person so that I can make sure people from all over the state are getting the training. Whether or not those providers or those employment specialists stay doing the work is another story. And I know there is at least one provider down in the southern part of the state that is doing the work. I mean, it really does work best when you have somebody that also kind of knows that area. Or, I mean, I'm happy to jump on virtually and brainstorm and get ideas and those sorts of things. I do some work in other states as well, and offer that kind of support. But yeah, we don't want this to be something that we share and say this is a service, but not for you, because there aren't any providers. And I think that's why we're hoping to offer some of these tools and guided group discovery to families. And again, it does put some of the ownership back on you. But I would love to come up with some ways that we can find ways to help people be able to do some of this work or figure out some of these strategies in some of the areas where we don't have providers.
I will add to, thank you, Tricia, because it reminded me that we do, as a VR agency, provide incentivized payments for rural areas. So if a provider will work in a rural area, they will get extra funding to do that. So that's one of our ways of incentivizing more providers to help with models like these in some of those areas. So.
Thank you. The next question is, where can we get the discovery process? My daughter has had VR, but not that service.
So if you are, I would say that if you are currently working with a VR counselor, I would let them know that you learned about the customized model and that you're interested in exploring that. I think Tricia mentioned earlier, we're still building capacity through the training. So it's going to be dependent if there is a certified person able to provide the service, but the start would be to talk to your VR counselor about it.
Thank you. The next question is, my son was working with VR, but was told he could no longer receive the service because he gets SSI.
So that sounds like a miscommunication somewhere. So we do work with individuals who are receiving benefits. And usually our VR counselors will talk to families and our clients about benefits planning. So if you want to know how benefits will be affected by working, we do have a team that can do that. They're called UWIPs. But if it's not true that we don't work with people who have benefits. Our job is to help make an informed choice. So if somebody has benefits and they want to pursue working, that's something that should be talked about with the counselor and whoever's involved, whatever team the person has. So.
Okay, thank you. Marianne, I'm not sure if you raised your hand again or if it is still up. Okay. You're on mute. Okay. I'll go to the next question. It says, do the customized employment services sometimes go through a local university? For example, my son is at SUU and works with a counselor to get an internship. I think she is employed through VR, and he had to apply and has a VR counselor off-site.
Oh, that's great. So it sounds like what your student is engaging in is something that we call pre-employment transition services with SUU. So we do have a contract with SUU to provide peer mentoring support for individuals, and then they also will help place individuals in internships over the summer. So it sounds like that's might be what's happening there, which is great. So
thank you. And then, do you have any special programs or resources specifically for the single parents?
I don't have any specifically for single parents. Again, I think this is, you know, in terms of the discovery process, it's really kind of looking at who is this person, who is their support team, and what does that look like? And if that involves trying to get more kind of support and build a network and a circle of support around that family, that's part of what we try to do. If you know, if that makes sense. I think it right. It's I would feel more comfortable even just kind of following up and figuring out how to individualize the supports you might need. I'd be happy to chat with you.
And we'll have the slides in our like when we post them, and Trisha's information is there as well. So if you're going to reach out to her, that's where you can find some information. We also had questions kind of from the beginning of the meeting. One is, do we need to be off the waiting list receiving services in order to receive caregiver compensation? So caregiver compensation does need funding associated with it. The request is for people who are in services so that we can have that as an ongoing service. We also, when people get one-time funding on the waiting list, caregiver compensation is one of the options that they have. Like they would be able to access respite. Caregiver compensation is one of them. So as an ongoing service, it's for people who are already in services, but there is an opportunity when you're getting one-time services through the waiting list. The next is, if part of caregiver compensation is from underused spousal plus additional money from the state, when the spousal monies are used up, won't you have to ask the state next fiscal year for more than they would be providing this year? That's a really great question. So the spousal caregiver compensation is ongoing money. So like when we ask for money for the waiting list, they give us new money that it stays in our budget from year to year. So that way, when someone comes off of the waiting list, they have money each year. So the spousal caregiver compensation money, that was put into our budget as an ongoing service. But because it wasn't all needed, we still have that ongoing money to use in an ongoing way. So we wouldn't have to ask for that money again. What we would have to ask for again, kind of depending on how things happen this session, is if we use one-time money in fiscal year 24, if we were to look at maintaining caregiver compensation, we would need to do another request to make up that difference, because the one-time part would expire after a year, but the spousal caregiver compensation would be ongoing and stay in someone's base, right in the base of their plan and their service package. And one of the questions that came in beforehand is, can parental caregivers be approved for Social Security benefits in addition to the child's SSI if the child needs 24/7 care? Do you know, when the demands are so unrelenting, the caregiver is in a non-working situation? Can our daughter's insurance be charged for such services? And what are the outside the box options? I do not know if, I think the Social Security question you would really need to take to Social Security. I wouldn't be right. That's a federal program. Our program is operated through the state, and it's a Medicaid service rather than a Social Security service. So I really wouldn't be able to speak to what options Social Security has. And I don't know about insurance either. I think it would be worth asking insurance if they, asking your insurance if they have anything, but that is not something I can speak to either. Just give a minute in case there are any other questions out there.
Angie, I see one in the chat about pre-ups and customized, so I can quickly answer that. They are different. Pre-employment transition services are a set of services for students with disabilities who are either eligible for vocational rehabilitation or VR, or potentially eligible for VR. So, but they are reserved for students. And I put our brochure on pre-ups in the chat. And then customized employment is a model for supported employment. So a model to help job seekers with employment. So one is kind of a employment prep for students, and then the other is finding the right fit for once somebody's ready for employment. I don't know if that helped clarify that.
Thank you, Amy. And it looks like there is a follow-up question. If the insurance is Utah Medicaid, I don't know, Joseph, if you have any insights on what would be available through Utah Medicaid outside of the waiver. Just a refresher, the question was, like, can insurance be charged for such services? I'm thinking like the respite type, caregiver comp type, so.
And the short answer is Medicaid is able to contemplate a number of different services and coverages at this stage. As far as what the state plan considers, no, there really isn't anything specific to caregivers. I think many of you are aware of in recent years the Medicaid expansion for working age adults that has taken place, but they're really this is the caregiver compensation bills that have been presented. This is kind of our first steps into that arena. There could be the opportunity to expand the benefit at a later date. And certainly the ability to leverage federal funds through Medicaid becomes attractive to lawmakers. The short answer is, however, not at this time, unfortunately.
Thank you, Joseph. And I saw some comments and just kind of want to talk a little bit about how people come into services, because there are comments about how long people have been waiting. And this is definitely a challenge, and it's difficult. We have a waiting list of currently over 4,500 people. And this past year, so in fiscal year 23, we received funding, $6 million, and it would bring in just over 400 people off of the waiting list into services. Additionally, we bring about just over 100 people into services through what we call attrition. So if someone leaves services for whatever reason, that funding is used to bring someone new into services. So if you look at that, like, our growth on the waiting list often exceeds the number of people who come into services. We've seen over the past several years that the trajectory of our waiting list just continues to grow even as people come into services. I know there is a lot of advocacy from the advocacy organizations that we shared with you about getting funding for the waiting list, how to impact that. I know our committee has had several questions around that too. I do think it's important, like someone said, keep your needs assessment updated because the squeaky wheel works. I think the reality is the funding is finite. So we do bring people into services based on the most critical need. So last year, 90% of the people that came off of the waiting list were based on most critical need. And then 10% were able to come in kind of on the flip side of that into the limited supports waiver. So with that, we look at, are their needs able to be met with this smaller package, right? It's a more limited support, more focused on keeping people at home and having supports in place. So with that, we are looking at, right, people who don't have the most critical need. And then we're looking at, of that group, once they've been identified, who has been waiting the longest. So the reality is sometimes people could be waiting for less than a week based on their situation. Sometimes there really are just crisis situations that come up and people are not waiting very long. Other times we have people on our waiting list who have been on there for over 20 years. And that is very hard, right? To think about, I just got a wave. I'm guessing that's one of them. And that is really hard to be waiting for services. So I agree, keep your information updated. But as we keep information updated for 4,500 people, a squeaky wheel is, it's just the reality of the money that we have to bring people into services. Everything we get that's dedicated to the waiting list goes to taking people off of the waiting list. Our attrition money goes to taking people off of the waiting list. And it really is just a funding question, truly. And we look at like what is available, how can we be most efficient? We really want to make sure we can maximize who we serve. So I have talked to many families and I can feel like the challenge, and I wish we had a better answer, and we will continue to like work and partner to find solutions and see what's possible. We have a funding request in this year. We'll see what happens. Representative Ward also put forward a bill that would commit funding to the waiting list every year. His goal was to make sure that he knows that there have been years that the waiting list didn't receive any funding, and he thought it was important to like put forward something, and so that would bring people off of the waiting list. But again, this is early in the session and we don't know what will come of that. But I do want you to know there are good advocates out there, both in advocacy organizations, in our legislature, and in the state who are really advocating for you and for the needs of people on the waiting list. And I'll just echo the thank you from the beginning that your voice matters. When legislators hear from you, when they understand the needs, your voice really matters. So thank you for that. And I think we have one more question. Is DSPD requiring more training for providers at this time? So providers in their contract have training requirements that they need to maintain. And when it comes to employment, they have some specific training requirements related to that too. I don't know that they have more training than they've had in the past, but there are training requirements for providers. And the question was, who put forward that bill? Representative Raymond Ward is who put forward that bill. And I see that someone expressed that they update their needs assessment every year and their number has changed. So there is that, and pretty significantly, and that can happen. I can think of two scenarios. When the needs assessment questionnaire was updated to the tool that we use now, before implementing that, the University of Utah surveyed everyone who was on the waiting list, and they held parent meetings to get feedback on what are the most critical needs that need to be measured, so that we can represent that when we're bringing people into services. And there were some things added that had not been in previous assessments that had significant feedback. One of them was parents identified that when they are having to provide care, like repositioning their child during the night, right, lifting, transferring, things like that, there wasn't a way that that was very well captured in the needs assessment previously. And that was added. And there were a couple of other factors that had not been well captured before. And so when all of those things were incorporated, it did result in people's needs scores changing. So some people shifted up and some people shifted down. And prior to doing that, we piloted it by doing the needs assessment that we currently use with 100% of the people who were on the waiting list, many of them twice, so that we had a good analysis and were able to share. Like, we held a meeting to make sure people understood, like, you could move as a result. That could be part of the big change between 200 and 2000, as we sought to make sure we were fully capturing needs of all families so that everyone could be represented. The other thing is that people's needs do change. So as people call in and update their needs assessment, as more people come onto the waiting list, depending on where their needs are, that could also be the cause of changing from 200 to 2000. So it is fluid because it is responsive to where people are at that time. Okay, so another question is, what procedures do you have to make sure that services are provided in the most cost-effective manner? So every single person we serve has a support coordinator who works with them and works to find their services and works to make sure those are based around that person's needs. And while we're seeking to support people's goals, we're really looking to, our focus is on making sure that need is met, and making sure those services meet that need. So the support coordinator is our front line for making sure that services are reasonable, right? That they're meeting that person's need and that they're not excessive. We also have the Office of Services Review, who reviews a sample of people receiving services every year. They'll review all of our providers, and one of the things they're assessing is the services are being provided. They make sense based on assessments and that are done. So that's another way that is addressed. The next question is, how can we best assist in the effort to advocate to get the state legislature to recognize the urgency of the need? Call our state rep. Yes, calling your state representative is great. And we can put our advocacy group links in the chat again. And they're on our slides. So if you go back and look at this, but we know that our advocacy agencies reach out regularly and communicate needs. We know families have shared their needs during the legislative session. So those are all ways that can be done. And then it looks like Deanna has her hand up. Go ahead, Deanna.
Hi, yes. Just a quick question. Sorry, I got on just a little bit late. I'm kind of new to all this DSPD stuff, but my daughter is getting off the waiting list and starting services on March 1st, which we're really excited about. But my question about the I've been working with the advocacy group as a parent, sending texts and emails to politicians, the senators and representatives for the bills going forward to have permanent caregiver compensation, and now the request of 200 more people a year coming off the waiting list for DSPD. The person that's kind of spearheading it, the lawyer, is Lisa Thornton. And so I don't know if that's the information you're giving is her, because when I first got set up with it, I emailed her to see if I could get put on her list. So when she sent out emails saying, I need you to do this, and I need you to send this to this, your story, your family, your picture, how you could benefit from this or how you have benefited from this. So I've kind of taken the approach of how we are going to benefit from this, because she hasn't started services yet. But what a difference it's going to make in our family to make it permanent. Because I mean, for me, anything's better than nothing. You know, we were on the waiting list for 6.5 years, and so I'm grateful for this. But it would only be a few months before they could potentially get rid of caregiver compensation if it doesn't pass as a bill. So one of my questions was, I kind of came in on this for the meeting, but the money that you're requesting for caregiver compensation for this next year, that is the money you're hoping to keep the program alive for the next year if it doesn't pass as a permanent option. Is that what that is?
Right. So in the governor's budget, part of the money we have is ongoing. It's reallocating money that's already in our budget. And part of it is one time because it's using our non-lapse. That's our carry forward one-time money. And I know that Senator Harper has a bill to make that actually ongoing. So I think his bill recognizes that we have part of the money in our budget already, and then his request is the additional money to make it ongoing. So yeah, so you're right. Like the Senator Harper's bill would make that ongoing if that passes and that funding is approved.
Right. And if it is not, those, like for my family who will be on for 3 months, if hypothetically it doesn't pass, which we're really hoping it will, but if it doesn't, we would potentially still have services hopefully for the next year.
Right, exactly. Because either way, there's money being requested, whether it's partially one time or all ongoing.
Right. Okay. And one more last question. I'm sorry.
I did just want to say, like, once the session is over and we know what the results are, we'll make sure that we're sending out an email so that everyone knows like what the outcome was of the general session.
That's great. That's wonderful. And I'm sure Lisa's been really good at sending kind of updates on how things are going in the session. And so if people can get on that, families, that would be amazing, because then like she sends like them updated, especially recently since they started the session of, okay, don't send anything right now. Wait until you hear from me to send this and then do this. And so it's just kind of specific, you know, and so it's good. And I know today she put one on of specific people who have representatives that they haven't heard from or haven't, that they need to have people reach out to, like one from Mapleton and Provo and Taylorsville, like to contact her so she can have you send a message to your representative, because you're their constituent. But my last question is, let's hypothetically say caregiver compensation does not pass. Those hours that are used, that you call that, you know, you've requested and gotten for caregiver compensation, are those reallocated to like supported living or respite care hours?
So if a family has caregiver compensation in their plan, it would just be used for different services if it didn't receive ongoing, right? If it didn't receive funding. And for many families, that's right. They were somewhere else and then moved to caregiver compensation. So yeah, it would just be using services that are available.
Right. And that's another like push towards the representatives saying, well, this money is available anyway for hours for my child, you know, for someone else to take care of my child, you know, but it would be nice I want to take care of my child, you know, in a lot of ways, right? Because sometimes you do need breaks and things like that. And that's where the respite care comes in to help with that. But that's another plea, I think, from families that they can send maybe to the representatives is, hey, the funding's there. This just gives me the option of choosing where it goes. You know, like how many hours I need for a break, or how many hours would benefit my family for me to be able to take care of her, because I want to take care of her and I know her best, you know, kind of. So anyway, just kind of a tip. I'm sure that you've already shared in the past, but anyway, thank you so much. I appreciate it.
Yeah, thank you. And there's a question that says, how do we get information from Lisa about session info? I'm sure Deanna can share that. I will say, I know she's been working with the Legislative Coalition, and they're sending out, like they're coordinating on those messages that are going out to people. So if you were to reach out to the Legislative Coalition for People with Disabilities, the email that's in the chat, the lcpd@utahlcpd.org, that I know that they are working together and sharing information. So that's one resource, but I would hesitate to share Lisa's email here myself. So
yes, I'm sure they could reach out to the Utah Parent Center and get that as well, or whatever, figure out how to do that.
yes, the Utah Parent Center is also definitely doing the same thing, right? Sending out those emails, getting that information out and coordinated. I do feel like they're all really working closely together. I think I don't have contact information for the Prader-Willi Foundation, but I know they are very engaged as well. So thank you for all of your questions, and thank you so much for your time. It looks like Bryn has his hand up. Yes, Bryn.
Thank you. I just wanted to return to one of the comments that was in the chat. This will be quick. The comment was saying that there are situations where sometimes working would be beneficial, but they need help with other activities of daily living, right? Like meals and transportation and hygiene needs. I did some checking just to make sure that I wasn't repeating something wrong. But if the person is in services, employment services would cover all of those needs, so that that person can still keep their job. If they are not in services and on the wait list, there's something called Employment Personal Assistance Services, or EPAS, and I will put a link in the chat. And the reason why I waited to respond is I wanted to make sure I was giving you correct information, but this is just a fact sheet for it. And yeah, just wanted to share that there are options available if people want to work. Thanks.
Thanks, Bryn. And since we are over time, we'll just go ahead, and I just want to reiterate, thank you so much for coming, for participating, for your questions. Our next meeting, our next quarterly meeting is February. Wait, that's okay. Our next meeting is May 10th. We just had our February meeting. Also, we have the Disability Advisory Council. We'll get that information in the chat for anyone who is interested. So thank you again, and I hope you all have a wonderful day.